Currently, we have in Montreal we have 126 cases that have been investigated. We only had 3 hospitalizations at the beginning of the outbreak, but currently we have no hospitalization, and the majority of cases are not severe. 100% of the cases are men having a sexual relationship with other men. And we have started the vaccination campaign for contacts at on the 27th of May, and now we have more than 3,000 vaccine or shots that have been administered. We will have access, but it's for the province of Quebec. We have an access right now of 40,000 doses, but for Montreal, with the enlargement of the criteria, we think that with 20,000 to 25,000 doses, we will have enough to cover the expected population that we are trying to reach. We think we had maybe a super spreader event at the end of April, linked with the other outbreaks that were in UK and Belgium and other European cities. And I think with this super spreader event, we are seeing other chain of transmission. And because in our chain of transmission we have a lot of anonymous contact, it is quite difficult to only, at the beginning, to control the outbreak with only isolating case and trying to find a contact. And this is why, by putting and giving access to a larger part of this population to vaccination, we think we can be able to manage a little bit more the outbreak. We are launching, or we are announcing the new criteria to access to vaccination. So before, we were offering vaccination to people that were contacts that were exposed, or that had an exposition in some places or events that had some cases. And now we're doing it in a pre-exposition way, so a prevention way. So we're asking men who are going to have, or who do have, or are going to have some sexual relationship with other men in Montreal during the summer, in the next few weeks or months. We are offering them the vaccination, so they can right now access. And we think it is an additional measure that we're putting in place to control the outbreak. We have a good collaboration of the community, but also community organization that works in the village with us. And this is what we're doing right now. We're trying, by enlarging vaccination, we're trying to prevent the spread, knowing that we will have visitors, we will have different events that can put more people at risk. It is difficult for us to know if we're going to have a big rise, but we think if we are able to vaccinate in the next 2 or 3 weeks the majority of people that can be at risk during the summer, I don't know if we're going to be able to have 0 cases, but of course we think we can at least manage the current outbreak.